Martin, looking ahead, what excites you most, and where's the next 10x opportunity in digital health?
Well, the first thing that excites me is this Cambrian explosion of all sorts of new amazing devices, but maybe even more is the evidence of patient empowerment and patient education. I'll give a really good example. Doreen Enright, she's a lady in her mid-70s, and she's recorded a video for me that I use in my teaching, and she talks about how using a Fitbit and an AliveCor device, which is a small device that will measure an ECG in 30 seconds, she and her GP were able to diagnose an issue that was taxing it, potentially life-threatening, and she'd been in to visit multiple cardiologists and they weren't able to track it, but she was able to detect by having her, patient-generated health record and the AliveCor to measure that she had supraventricular tachycardia. So she was able to have an ablation, and it's completely fixed the problem. But at the end of her video, she says, first, people call me a geriatric, and I hate that term, so please don't call me a geriatric. But this example shows, empowered, educated patients with digital technology, in co-production with their patients, can actually adopt this technology. So I'm really motivated by seeing somebody like Doreen taking the technology, and often people talk, there's going to be a digital divide. I think there can be a digital dividend. So we need to make these solutions. There's no manual with the iPhone. They are so easy to use. You don't need training. And for example, what I'm witnessing here with Heidi, there's no training. You just speak. It's so, you're able to speak, and the AI tool annotates it and puts the data in faithfully. And then hopefully we get this new cadre of political leaders, and I'm hugely inspired by Wes Streeting and Keir Starmer here in Ireland. I would not be familiar with UK politics, but in Ireland I just met for the first time Jennifer Carroll McNeil. She's a lawyer. We met last week. I gave her a copy of my book, and somebody who has energy and vision and really wants to make a difference. So I think this combination of amazing innovation going on, the willingness of patients and people to be educated and adopt it, and then in combination with, new political leadership, it really is creating the conditions for the metamorphosis of, a health system. And again, to come here, and I know it's a pretty safe thing to say, I'm in here in your studio, but 7, 8, 9, 10 examples of this at work. We've been over at the primary care network, which is in the building, and talking to some of the team there and how they're able to make real-time modifications to prescriptions. The idea of social prescribing, loneliness is emerging, as Vivek Murthy, the last U.S. Secretary or Surgeon General, talking about loneliness, the new smoking, and to hear about some of the social prescribing interventions to help with that. So it's been really motivating to visit here, and I'm hoping you're going to give me a V-scan echo test after this before I go to the airport.
Absolutely.
Rejection fraction.
Absolutely. No, definitely.